Have you ever wondered why not many healthcare professionals will tell you that you can solve your age-related problem naturally without surgery? Well, it's not mainstream just yet. What is mainstream is to take medications, have an injection, even get surgery for conditions like osteoarthritis, cartilage problems, tendinitis, bursitis issues, and many other itis, age-related musculoskeletal conditions. I'll tell you more about why the medical field does not recommend natural solutions. But first, let me tell you about a story about a Hungarian doctor from the 1840s named Dr. Semmelweis. He worked in a maternity ward led by other doctors. And next door to his maternity ward was a midwife-led maternity ward. He noticed that there was a significant amount of deaths happening in his maternity ward, and it was much higher than the midwife-led maternity ward. He also realized that many of the doctors in his ward were coming out of autopsies prior to doing surgeries with the patients in the doctor-led ward. And he thought that there was some connection to this. Now, bear in mind, this is the 1840s. The idea of germs and contagious diseases was nowhere near well-formed. Microscopes were barely coming into development, and it was thought that many diseases were passed on from sins from yourself or your family, and it was like a curse or maybe even a spirit. The idea of contagious diseases, bacteria, and microscopic viruses were not at all at the forefront of the medical mind. They weren't even a thought. But he decided to test his theories about the doctors coming out of autopsies and going into treatments with patients by having them simply wash their hands with chlorinated water. And his results were amazing. The death rates in his doctor-led maternity ward went from 18% down to 2.2%. Dr. Semmelweis went to share this groundbreaking information with the medical community, but he was shunned by everyone. And I think it was because many doctors were afraid to have to admit to the communities around them that they had been unknowingly killing their patients by not simply washing their hands. And in order to save face, they did not allow Dr. Semmelweis' information to be widespread, common medical practice. They kept their old practices. This is a medical belief that ended up very wrong. They actually even questioned Dr. Semmelweis' sanity, ended up admitting him into a mental facility where he was beaten and later died from his injuries. And it wasn't until the 1980s that hand washing became normal in the medical community and across the globe, that soap and hand sanitizer became something that is ubiquitous. You can find it just about anywhere. But our understanding of viruses and bacteria, microscopic things that can be passed on, contagious diseases, is much more advanced now, and it's clear that hand washing is a very simple, cost-effective solution that can prevent that. This isn't the only story of medical beliefs that ended up very wrong. You could look up stories about thalidomide, Vioxx, and even flossing at one point was thought to be not a good thing to do. Even cigarettes were once endorsed by physicians in the early 1900s. Now let's bring it back to surgery for age-related conditions. I think we have a similar situation here where surgery is overdone for many orthopedic conditions. It can seem that this technology, these advancements can save you from the problems. But is there a simpler solution that we're completely overlooking because of all the technology and procedures and supposed advancements? Our understanding of muscle imbalances in the medical community is tiny. And I often feel like Dr. Semmelweis whenever I'm talking about muscle imbalances, as I do all over this channel, because it is not something that's widespread, common knowledge, and that's recommended by healthcare professionals to their patients, yet it is a very viable, natural solution to allow people to heal their problem, even if it's age-related, because it is just exercise done a specific way in a particular cadence so that you can heal the tissues naturally. Now, I'd like you to put this to the test because you're probably putting other things to the test. Maybe you visited your doctor and you're putting their medical advice to the test. They're telling you to take medications, of course, to do certain exercises, maybe even get surgical procedures that you've already had. And if you're not getting the result that you want, where you're more mobile, more active, and you're able to do everything that you want to do, then it's not working for you. Could it be that that healthcare professional that you've seen does not have the best information for your specific situation? Maybe they're excellent at something else, but maybe when it comes to treating arthritis naturally, they're not the best. Their information's antiquated. Their ideas on exercising for this problem are not accurate. And let me tell you about the age-related concept, because so many healthcare professionals will blame your problem on your age. If you've got knee arthritis on the right knee, what about the left knee? It's just as old as the right knee. If you have a disc herniation or a degeneration somewhere in your spine at, say, L5S1 or L4L5, what about the levels above that? What about L3L4 and L2L1? Those discs and those joints in the spine are just as old as the ones below that. If you have a labral tear or hip arthritis on one of your hips, what about the other hip? Same goes for the shoulder. We can argue this for any body part. Your entire body is the same age, so for a healthcare provider to blame your problem on simply age, I think is not really looking deep enough into the problem. There's usually a root muscle imbalance affecting the pressures in that joint, and exercising a specific way to put the muscles in proper balance can decrease the pressures through that joint and allow it to heal. Just like the medical community in the 1840s around Dr. Semmelweis looked at hand washing, I think that's what we're doing today when it comes to surgeries. Now, I'm not saying that surgery is always bad. There's definitely a time and place for surgery when it needs to happen, and I am so thankful that we have surgeons out there that know what they're doing and can really improve people's lives. All I'm saying is that there's other solutions to these age-related problems. They're not really age-related, they're muscle imbalances usually. And it is possible to completely avoid surgery in many cases and heal and get back to being healthy, active, and mobile again. We've got to get away from treatments, focus on the symptoms, and deal with the root problem, and that usually comes back to treating the muscle imbalance. Hey, if you thought this video was helpful, please give it a thumbs up. Please share this with somebody you think needs to see this, and also subscribe to our channel and turn on our notification bell so that you don't miss out on any of our helpful videos. Thank you so much for watching. I'll see you in the next video. Bye-bye.